One of the best and worst things about our body is that most times waiting, things feel better. The reason it's good is because most of the times you can just wait and get back to what you do. The bad part is sometimes you just keep waiting. Tomorrow my shoulder's gonna feel better. Tomorrow my shoulder's gonna feel better. And then sometimes it doesn't. So who do you see at that point? Well, I think I would argue that you would see the expert in shoulders. You might think an orthopedist, but you also have to think about what are the tools that they have. So if your bone is poking out of your skin, an orthopedist is probably the person you want to see. If it's kind of a sore joint, maybe you could see your primary care, but you have to think about what their tools are and what their expertise is. The orthopedist can do surgery or an injection. If that's not what you're after, that's probably not the person that you want to see. Oftentimes they just tell people just wait and see. Just wait, and if your inflammation doesn't calm down, come back, we'll inject it. Go back to what you're doing. If it still hurts, I'll cut on it. If that's not your goal, then that's probably not the person you want to see. So I would argue that a physical therapist would be the person that you want to see. They're trained in movement. Orthopedists are trained in bone and joint, doing surgery on those. So a physical therapist can help you, one, acutely get out of pain, two, assess the deficits that may have led to that and work on those deficits, and then give you a plan out of that. The same way I know a little bit about the liver and liver enzymes and blood values and all that, that's kind of how a physician, primary care, understands joints. So a lot of times they're gonna put you on a steroid pack, tell you to rest, maybe do an injection, even though that's not really their specialty, and you gotta get those things in just the right place. And they're finding that those can actually speed up the degeneration process. So depending on your goals is depending on who the expert you're gonna see. If your goal is not surgery and not pills, I would argue a good physical therapist is who you wanna see.